Welcome back to my YouTube channel. If you are new to my channel, welcome to MedCode Insight. Hi, I am Nashaba, a certified medical coder. In this video, we will go over some important practice questions from the auditory system along with guidelines and quick elimination methods so you can choose the correct option within a minute. So without further ado, let's get started. A 50-year-old patient with Meniere's disease present for transcanal chemical labyrinthectomy of the right ear. Dr. Miller visualized the tympanic membrane using an operating microscope, cleans the ear canal, and makes a small incision in the tympanic membrane. The patient is repositioned with the right ear facing upward and is monitored by the nurse. The perforation is repeated to achieve the maximum result. The ear is suctioned, cleaned, and carefully examined for bleeding. The patient tolerates the procedure well and is returned to the recovery area in the satisfactory condition. However, Dr. Miller report his professional services. Option A with code 69801 into 2, 69990 along with modifier 51. Option B with code 69905 into 2, 69990 along with modifier 51. Option C with code 69801, 69990. Option D with code 69905, 69990. As in this scenario, transnasal labyrinthectomy of the right ear is performed. We first eliminate option B and C used for labyrinthectomy procedure. In the remaining two option A and C, we easily eliminate option A based on the modifier 51 used with add-on code 69990. So the correct option is option C with code 69801 used for labyrinthectomy with perfusion of vestibule active drugs, transnasal with add-on code 69990 used for an operating microscope. Sarah Thompson presents with a perforation in the right tympanic membrane. In the operating room, the surgeon gently deprives the margin of the perforation using a rosin needle. A small incision is made in the inferior portion of the earlobe and a fat graft is harvested. The harvested fat graft is then shaped and inserted into the perforation in the dumbbell fashion to plug the hole in the eardrum. Additional gem form plates are placed around the graft to hold it securely in the place. Find the correct CPT code for this procedure. Option A with code 69610, option B with code 69620, option C with code 69631, option D with code 69676. In this scenario, surgical repair of the perforation of the eardrum is performed. As tissue graft is harvested and used for repair, our most appropriate option is option B with code 69620 used for myringoplasty, surgery confined to drum head and donor area. Code 69610 in option A is used when the repair of the perforated eardrum may include side preparation or roughening of the side before closure and may also include applying a paper paste to the closure. In option C, code 69631 is used for the repair of perforation which involve reshaping of the ear canal or removing a part of actic or other surgeries on the middle ear. Code 69676 in option D is also incorrect because this code referred to severing of the tympanic nerve, typically done to treat glandular disorder or parotid duct fistulas, which is unrelated to eardrum repair. A 5-year-old female with prominent ears undergo a bilateral otoplasty. Surgeons make an incision just behind the ear in the natural fold where the ear is joined to the head, exposing the cartilage. Cartilage is trimmed and shaped and incision is closed. Temporary sutures are placed to secure the ear until healing is accomplished. The procedure is repeated on the other ear. What CPT code is reported? Option A with code 69300 into 2. Option B with code 69300 along with modifier 50. Option C with code 69310 along with modifier 50. Option D with code 69120 along with modifier 22. In this scenario, a female patient with prominent ears undergo bilateral otoplasty. Otoplasty is a surgical procedure performed to change the shape, size, or position of the ear often performed to correct protruding ears. The appropriate code for otoplasty is 69300. Since the procedure performed bilaterally, the correct option is option B with code 69300 along with modifier 50. Option A is incorrect because bilateral procedure should not be reported with 2 units of core 69300. We also eliminate option C because core 69310 is used for reconstruction of the external ear canal to treat acquired stenosis. Option D is eliminated because core 69120 refers to a complete removal of a diseased external ear, which does not apply in this case. A 5-year-old child with chronic otitis media and fluid buildup in both ears was admitted by her otolaryngologist for bilateral tympanostomy. The procedure was performed with placement of ventilating tubes. The procedure required general anesthesia due to patient's age. Select the procedure code for this procedure. Option A with code 69420 along with modifier 50. Option B with code 69421 along with modifier 50. Option C with code 69433 along with modifier 50. Option D with code 69436 along with modifier 50. In this scenario, bilateral tympanostomy is performed. We first eliminate option A and B as both codes in both options are used for myringotomy procedures. Tympanostomy cords are based on the anesthesia used during the procedure. Since the procedure was performed under general anesthesia, we eliminate option C with code 69403 used for the same procedure but performed under local or tropical anesthesia. Therefore, the correct option is option D with code 69436 used for tympanostomy required insertion of ventilating tube performed under general anesthesia. As the procedure performed bilaterally, we use modifier 50. A post-auricular incision is made on the right ear. Using an operating microscope, the surgeon visualizes and reflects the skin flap and posterior eardrum forward. A small leak from the middle ear into the round window is noted. The surgeon then roughens the surface of the window and packs it with fat. Upon retraction, the eardrum and the skin flap are replaced and the canal is packed. The surgeon then sutures the post-auricular incision. The procedure is then repeated on the left ear. Select the procedure code for this procedure. Option A with code 69666 along with modifier 50, 69990. Option B with code 69667 along with modifier 50, 69990. Option C with code 69666, 69990. Option D with code 69667 along with modifier 50. As in this scenario, repair of round window is performed. We first eliminate option A and C with code 69666 used for repair of an oval window. In remaining two option B and D, we choose the correct code based on the add-on code 69990 used for an operating microscope. Before reporting add-on code in addition to the primary procedure, we must check the code range listed above the add-on code 69990. If the primary procedure code falls within date range, the microscope is considered bundled and should not be reported separately. However, in this case, the code 69667 is not listed in the bundled code range under code 69990, which means we can report the operating microscope separately. So our correct option is option B with code 69667 along with modifier 50 and add-on code 69990. A 60-year-old patient with decreased hearing decided to undergo bilateral cochlear device implantation in order to restore his hearing. Due to the position and the size of the device, mastectomy was necessary for the completion of the cochlear device implantation procedure. How would you code for the procedure? Option A with code 69930, 69502. Option B with code 69930, 69505. Option C with code 69930 along with modifier 50, 69505. Option D with code 69930 along with modifier 50. In this scenario, bilateral cochlear device implantation with mastoidectomy is being performed. The CPT code 69930 is used for cochlear device implantation and it already includes the mastoidectomy as part of the procedure. Therefore, we don't need to code the mastoidectomy separately. Therefore, we eliminate option A, B, and C as they incorrectly include separate code for the mastoidectomy. So for bilateral cochlear device implantation with mastoidectomy, the correct option is option D with code 69930 along with modifier 50. Thank you for watching. If you have any question or need further clarification, please feel free to write in the comment section. For more detailed guidelines, CPC mock exam related questions and notes, email me at the giving email ID.